Hey, pet parents, we're going to talk about hemangiosarcoma. Holy splenic tumor, Batman. Hemangiosarcoma is brutal. The diagnosis often starts with emergency surgery because the tumor on the spleen that you didn't know was even there burst inside your dog. We're going to talk about splenic hemangiosarcoma today because it's the most common form. So if you're lucky, your dog might give you a clue that they have hemangiosarcoma brewing inside their abdomen. Things like weight loss, lack of appetite, intermittent weakness, vomiting, bruising, a distended abdomen, or pale gums that maybe come and go. Or maybe your vet does an exam on your dog and feels a mass in the abdomen, or does some tests like x-rays or ultrasound and finds it. Hemangiosarcoma is insidious. It's a freaking ticking time bomb. And by the time it's diagnosed, it's probably metastasized to the liver. So that's a whole nother area that has to be addressed. Conventional medicine is life-saving. A splenectomy to remove the spleen, along with the tumors associated with it, is critical. When your dog is diagnosed with hemangiosarcoma, your conventional vet will tell you we can do surgery, maybe chemo, and the average survival is 3 to 6 months. So you're left feeling like there's nothing else you can do. But I'm here to tell you that that's not the whole story. In a 2023 peer-reviewed clinical study that was published in the Journal of Veterinary and Comparative Oncology, Dr. Aaron Banick, a board-certified veterinary oncologist, teamed up with Dr. Steve Marsden, one of the most experienced veterinary herbalists in North America, hands down, did a study. They followed 24 dogs with splenic hemangiosarcoma who received an integrative herbal protocol after surgery. And they found that with this protocol, the median survival time of these dogs was over 18 months. And some of the dogs were still alive when the study ended. In fact, in order to get the research published in the journal, they had to take out the dogs that lived a super long time, the outliers that lived 3, 4, 5 years after surgery. They had to throw those out of their research because it skewed the research so much that they must have figured it was unbelievable. But I believe it because that's what happens in holistic medicine. These are the kind of results we get. So today I'm going to walk you through what this protocol involves, what the published research says, and most importantly, what you can do for your dog. Because I want you to leave today with clarity and a plan. Not just hope. That's important too, but not just hope. So let's dive in. Splenic hemangiosarcoma is a malignant tumor of the blood vessels in the spleen. It occurs in dogs more frequently than any other living being, including humans. And it typically shows up in our older large breed dogs like golden retrievers, German shepherds, labs, boxers, Dobermans. And so because it shows up in a lot of specific breeds, they suspect that there's a hereditary cause. But in people, they've actually found that arsenic can induce hemangiosarcoma in people. And in a 2020 case-controlled study, they showed that neutering, so spay and neuter in male and female dogs, increases the risk of developing hemangiosarcoma. But what makes it so tricky is that dogs with splenic hemangiosarcoma can have vague symptoms or no symptoms at all. And a lot of pet parents describe what happened when a tumor was found in their dog, that it just happened out of nowhere. One day, their dog was fine, and the next day they're in the ER having surgery. The other thing that makes this cancer so challenging is that it's almost always metastasized, especially to the liver, at the time of diagnosis. So even if the x-ray and the ultrasound look fine and the spleen is removed, there's usually microscopic disease in the liver that has spread to the liver, but you can't see it on the ultrasound. So that's why surgery alone has such poor outcomes, is because it's by the time it's detected, it's already spread to the liver. So in traditional Chinese medicine, hemangiosarcoma is considered blood stasis, which is obstructed blood flow. And areas of poor circulation have reduced oxygenation, and those are the areas that tend to become cancerous or form cancerous growths. So cancer is basically the end result of chronic inflammation, stagnation or blood stasis, immune dysfunction, and environmental factors. And we'll go over some of those environmental factors. What's really interesting is you can actually run a test to detect hemangiosarcoma in your dog. And it's a urine test that you can do at home. It's really interesting. Let me get the QR code. It's got a 90% accuracy rate for hemangiosarcoma. So you actually collect a urine sample and send it in. Super interesting test. Tests for hemangiosarcoma, lymphoma, mast cell tumors, and melanoma. And I find that it's really more accurate than some of the blood tests out there. All right, so conventional treatment is important. So surgical removal of the cancerous spleen, called a splenectomy, removes the tumor or the mass and removes the immediate bleeding risk. So this is the first step, regardless of what else we do. So in the published research, when surgery is done alone and there's no follow-up treatment, a dog will typically survive for 2 weeks to 3 months. If the dog has surgery and doxorubicin chemotherapy, they'll survive about 4 to 6 months. Not that great, right? So let's talk about what Dr. Marsden and Dr. Banning found in their study in 2023. Dr. Bannock is, like I said, a board-certified veterinary oncologist, and your veterinary oncologist is her colleague. And some of these oncologists and veterinarians seem like they don't, or they're not aware of the research, but it's out there. So in the study that Dr. Aaron Bannock and Dr. Steve Marsden did, 24 dogs with confirmed splenic hemangiosarcoma were included, and they had a splenectomy. Some received chemotherapy and herbs, and some received herbs alone. The overall survival time for all 24 dogs was over 18 months. Wow. So let's go over some of the survival times that we just talked about. Surgery alone, 2 weeks to 3 months. Surgery plus chemo, like the doxorubicin chemo, which is typical, 4.5 to 6 months. Surgery plus metronomic chemo, which is chemotherapy at lower doses for a longer time. Survival time is generally about 6 months, so not much better. For surgery with turkey tail mushrooms, there's actually a study at Penn State, Penn State, Pennsylvania State, that studied survival times for hemangiosarcoma patients using just turkey tail alone after surgery. And they lived 6.5 months after surgery. So about the same as chemotherapy without the side effects. So surgery plus the herbal protocol with no chemo survival time was 17 months. And in the dogs that had surgery and the herbal protocol and chemo, survival time was 22 months, which is not terribly significant, between 17 and 22 months, especially considering that the dogs getting chemo probably didn't have as good of a quality of life as the dogs not getting chemo, because there are a lot of side effects with chemo. Okay, so let's go over the 5 pillars of this protocol, this herbal protocol, and it's a multi-pronged approach, and it's generally done after surgery. Granted, things can go on before surgery, but it's with surgery, we combine this herbal protocol. So we remove the spleen and the tumor, and then the first thing we do, and maybe even before surgery or prior to surgery, is we use Yunnan Baiyao. And Yunnan Baiyao is a Chinese herb. It's a traditional herbal formula to control bleeding. But what's really interesting about it is in a 2016 study, they found that the Yunnan Baiyao was tested directly on dog hemangiosarcoma cells, and it didn't just slow down the cancer cells, it induced cancer cell death or apoptosis. It was also dose dependent and time dependent, which means the more that was used and the longer that it was used, the more cancer cells died, which is awesome. And in another study, dogs that got Yunnan Baiyao along with surgery and chemo had a longer disease-free interval, which means a longer time without cancer before it metastasized. And then in another study in 2008, the key ingredient, which is Sanchi or Panax notoginseng, they found to be cardioprotective. And that means that it will help protect the heart from the damaging side effects of doxorubicin chemotherapy, which also affects the heart. So it can actually prevent heart problems that can be induced by the chemotherapy. So it has protective effects. The next thing that we use, pillar 2, is the HSA compound, which is an herbal formula. It's a custom herbal formula developed by Dr. Aaron Bannock and Dr. Steve Marsden, and it's a modification of Xiao Chai Hutong or minor bupleurum. And we talked about that last week, I think, or the week before. So there's a whole video on Xiao Chai Hutong and minor bupleurum. But the HSA compound has the base of Xiao Chai Hutong in it, but it's modified. They add other herbs and change the formula a little bit to make it more anti-cancer for hemangiosarcoma and more appropriate for hemangiosarcoma. One of the things that the herbs in the HSA compound do, some of the herbs, is blocks VEGF, which is vascular endothelial growth factor. So basically this signals the body to produce new blood cells. So it helps the cancer produce new blood cells. So it blocks that so that the tumor can't produce more blood vessels. Some of the herbs in the formula also block IL-8, which is interleukin 8. And interleukin 8 promotes hemangiosarcoma cell survival. So if we block it, we're blocking the cell survival of the cancer cells. It also, the formula also has herbs in it that induce apoptosis through multiple pathways. So there are multiple herbs that are anti-cancer that use multiple different pathways to induce cancer cell death. So it's pretty impressive. Pillar 3 is a constitutional formula. So a constitutional formula means that we use an herbal formula based on your particular dog's issues. So we look at the whole dog, we figure out what the other issues are and what the dog needs, along with the anti-cancer formula and the Yunnan Bio. So it's a secondary formula that's chosen based on your dog's constitutional pattern or traditional Chinese medicine um, pattern diagnosis. So you can have the same cancer diagnosis, but all the dogs will have different underlying patterns. One might have blood stagnation with heat, another might have spleen qi deficiency with dampness, another might have liver qi stagnation. So the constitutional formula addresses the terrain, the underlying imbalance that allowed the cancer to develop in the first place. And we have to support the pet in whatever deficiencies they have in order for their immune system to kick in and help fight that cancer. No, it's not one size fits all. So your dog, we have to determine what's going on with your dog and what formula they may need besides the anti-cancer formulas. And so you'll always want to work with a veterinary herbalist or a holistic veterinarian that knows herbs. I do telehealth consults. Let me put that QR code up where I'll go through your pet's records. You fill out intake forms and answer all kinds of funny questions. You send me pictures of your pet's tongue, and I do tongue diagnosis to try to help me pinpoint what the Chinese pattern diagnosis is in your dog, so I can determine what formula your dog needs besides the anti-cancer formula. Okay. So pillar 4 is medicinal mushrooms. Turkey tail mushrooms are the most studied mushroom for cancer in dogs, and we'll use turkey tail mushrooms for dogs with hemangiosarcoma. But the key is we use them at a very high dose, and that's been shown in studies. They actually tried different doses, several different doses in dogs, and they found that the 100 milligrams per kilogram per day dose was ideal for dogs with cancer. So turkey tail mushrooms modulate the immune system. They have things like polysaccharides or polysaccharopeptides that activate natural killer cells, enhance macrophage function, and macrophages are the cells, the white blood cells that go in and clean up debris. They upregulate the immune system's ability to recognize and destroy cancer cells. So mushrooms are super important, and we use high-dose turkey tail mushrooms. Pillar 5 is bilberry and other supportive supplements. So bilberry is a Western herb that has anti-angiogenic properties, meaning it starves tumors of their blood supply. It also blocks the interleukin 8 activity that we talked about earlier. I'll talk about the other supportive supplements after this next one. So those were the 5 pillars, but there's actually a ground zero, what I call pillar 0. So ground 0 is diet, and a fresh food diet is super important for any pet, especially pets with cancer. And there's actually research to show that. So whether the diet made a difference or not was not something that was specifically looked at in that 2023 research study that Dr. Bannock and Dr. Marsden did. But the data, when they ran the data, it actually came out to be pretty significant. So what they found was dogs fed a fresh whole food diet had a median survival time of 12 months and a 60% 1-year survival rate, meaning 60% of the dogs on a whole food diet made it to 1 year. Dogs fed kibble had a median survival time of 5 months, and this is with the herbs. And their 1 year survival rate was 0. So none of the dogs that were eating kibble made it to a year, even though they were on the herbal protocol. But 60% of them did when they were on a fresh food diet. That's significant. A fresh food diet provides better nutrition, it's more bioavailable, has fewer inflammatory triggers, meaning, it doesn't have any of the advanced glycation end products and oxidated fats that come with the ultra processed kibble and canned foods. And this is really within your control. It's supported by data, it's based on what we're seeing, and it's one of the biggest single factors in long-term outcomes, feeding fresh food. Let me show you some of my favorite diets. Here's Dr. Judy Morgan's food, I'll provide. I really like this one. It's meat, organs, and vegetables. Same with Raised Right. Karen Becker and Barbara Royale formulated this one. Meat, organ meat, vegetables. The key is we want to avoid the starchy carbs. So the starchy carbohydrates like pasta, white potato, rice will cause inflammation and increase the glucose or the sugar in the body, and cancer feeds off sugar. So we don't want to do that. So the other supportive strategies that I alluded to are things like IP6, which actually enhances natural killer cell activity. It reduces free radicals, which cause inflammation. So it reduces inflammation, and it strengthens the immune system. Another core supplement is omega-3 fatty acids from fish oil. That's foundational. It's anti-inflammatory, and it supports cell membrane health. So we really want to do some fish oil or fish animal-based omega-3 fatty acids. Vitamin D supplementation. Most dogs with cancer, and really cats and people and anyone that gets a chronic disease, tends to be low on vitamin D. So low levels of vitamin D are associated with illness and worse cancer outcomes. So we don't just supplement vitamin D, we do testing. So we test vitamin D. Let me show you an at-home test. Oops, where'd it go? There's an at-home test. You actually have to get a blood sample, so you have to get the sample from, your vet will help you, but you can send it in yourself. So you get the vitamin D test kit, send in the sample, and you'll get the results as well as what supplement to give and how much to give. All right. Another core supplement is CBD. CBD has anti-tumor properties. It's anti-inflammatory, helps with pain, helps with appetite. It's a great supplement for cancer. It's very common. Oh, but you want to get a reputable brand. There's a lot of junk out there. Let me show you one of mine that I like. All right. This is a company, CBD for Dogs, that is reputable and what I recommend for CBD. Another core supplement for dogs with cancer is turmeric or curcumin. There is a ton of research. In fact, I think turmeric is the most researched single herb out there. It's got a ton of research behind it. It is anti-cancer. It's anti-inflammatory. It's anti just about everything. It's absolutely amazing. Another core supplement that I use for cancer, and it's not really a supplement, is frankincense essential oil. It's heavily researched for anti-tumor activity, and it's easy to give or apply because you can use it topically. You can just pet it on your dog, or you can diffuse it in the house. It's excellent. So other things that are appropriate for dogs with hemangiosarcoma are things like acupuncture. Acupuncture can help with pain, some of the side effects like nausea. It it will stimulate the immune system or regulate the immune system. It helps with overall quality of life, but there are also protocols with acupuncture that are anti-cancer. So acupuncture is a great idea as long as your dog is the type of dog that would enjoy it. So maybe your lab or your golden retriever. But if you've got a Rottweiler that's ready to lunge at your veterinarian, that's too stressful for the dog, and too stressful for the veterinarian. So um, if if you want to do acupuncture, your pet needs to be um, um, the right personality for it. So you don't want to do anything that stresses your dog out because stress suppresses the immune system. And for some dogs, acupuncture is stressful, so it's not worth it because you're just suppressing the immune system and you just need to pick other things. But it's an option. Other options are things like IV vitamin C therapy, ozone therapy, mistletoe therapy, bloodroot. There's even repurposed drugs. So like the Panicure or fenbendazole, ivermectin. And those have research. These all have research behind them. Fenbendazole and ivermectin have a ton of research showing that they are anti-cancer. It even shows what pathways they use to be anti-cancer. And so I actually was reading a record where a vet very confidently told the pet parent that ivermectin and fenbendazole had no research behind it, so not to use it, that it was just a fad. And I was like, well, that's not quite true. Okay. So, your action plan. What do you do now? Your dog's been diagnosed with hemangiosarcoma. Maybe they've already had surgery. If they haven't had surgery, if they're not at anesthetic risk, get the surgery. That's first priority. But they have to be a good surgical candidate. So talk to your vet about that. Step 2 is discuss chemotherapy with your oncologist. That's a personal preference. We went through the statistics, and if you remember correctly, the surgery with chemo and the herbal protocol and surgery with the herbal protocol, no chemo, had pretty much the same survival rate. And the ones that don't get chemo don't have chemo side effects, right? So you have to think about quality of life. And you definitely want to, if you're considering chemo, you talk to an oncologist and decide for yourself what you want to do because it is an option. Um, but if your oncologist says to throw out all the herbs and supplements because there's no research, they're wrong. There is research, and there's research by their colleague. So step 3 is get a consultation with a veterinarian trained in integrative oncology or traditional Chinese medicine, or both, like me. So I think I already told you about my consults, but let me pop that up again. My telehealth consult. Because we want to prescribe the protocol or the herbal formulas based on your pet's unique situation. So it's personalized. Every pet is going to have a different pattern and different herbs that are indicated. So it's important to optimize. It's important to know that in order to optimize herbal safety, how great it works, and the outcomes. It's not cookie cutter medicine, and that's what makes it work. It's all individualized and personalized. All right, step 4, things you can start today. Yunnan Biao. It's anti-cancer. It controls bleeding. because a lot of times if you have the surgery done and the spleen and the tumor is gone, you still have tumors um, in the liver. You have metastasis to the liver, and those can bleed. So Unibio is super important. Turkey tail mushroom, 100 milligrams per kilogram per day, is really important. High doses, you don't want to underdose. The higher doses have the most benefit. Fresh food diet. Transition your dog to a fresh food diet if you haven't already. Remember my favorite foods. I'll Provide is one of my favorite foods, and Raised Right is one of my favorite foods. I do have a list of more favorite foods. So if you contact me on Instagram, I'll give you my list. Let me get my Instagram handle. Let me see if I can find that. There it is. Okay. So just follow me on Instagram and message me, and just tell me that you saw this video and you want the dog food list, my favorite dog food list, and I'll send you that. All right. Other things you can do: add fish oil and omega-3 fatty acid. Get the vitamin D level tested. All right. Remember the test? Let's see. It's a test kit you can get and submit the sample yourself. You'll just need your vet's help to get the sample. There it is. Vitamin D test. All right. And other things that I use that are core supplements are things like probiotics, digestive enzymes, antioxidants. In fact, I put together a supplement bundle for pets with cancer. Let me show you that. So it's got things in there like the turkey tail mushrooms and the probiotics and the fish oil and all the core supplements for cancer. So check that out. All right. So you have options, right? You have a lot of options. Holistic care can extend life while maintaining quality of life. There's specific herbs, there's herbal formulas, there's supplements, and these protocols have been scientifically shown to modulate the immune system, induce cancer cell death, suppress metastasis or prevent metastasis, improve sensitivity to chemotherapy, so it makes the chemotherapy work better while decreasing the side effects of chemo if you choose to use chemo. And this isn't wishful thinking. It's published data from a board-certified oncologist. Oh, let me tell you about River. So River is a patient that I had years ago. And while I was thinking about doing this live video, I thought of her. And she came to me. She had hemangiosarcoma, and she had had surgery, and she had metastasis to the liver. So she had lumps in the liver already, and the pet parents came to me for help. And let me find her text. The pet parent would call me the voodoo doctor. She would tell her family that she's taking River to the voodoo doctor, because I did acupuncture on her regularly. She was on a fresh food diet. She was on this herbal protocol and the core supplements. She was doing all the things. And when they re-ultrasounded the abdomen, the lumps or the metastasis in the liver were gone. It was amazing. So the pet parent said, "Thank you for everything you did to help her have more than 2 wonderful years past what the vet thought possible. You're truly a gift to animals." So this dog had a fabulous quality of life, lived 2 years after the surgery, and she was old. She wasn't a spring chicken when this was all happening. and she did very well. In fact, better than anyone expected. All right, so diet matters. That's one of the most powerful and accessible interventions available to you, and it's completely within your control starting today. So if your pet is still on kibble or canned, start transitioning. It makes a huge difference, and it supercharges all the herbs and supplements that you use. It helps them work better so that your dog can beat this thing, live comfortably for as long as possible.